Hello, everybody. Reed here. We're going to have a very interesting conversation today, and it's going to be on Marjorie Taylor Greene. The the name of this podcast is this series is the Singularity. And the singularity is the point when AI takes over basically practically everything and creates two classes, the haves and the have-nots. And this separation is permanent. And so I believe the singularity is here when I start seeing things that you never really see, that you don't predict. Here we are, mega party is breaking apart. And I think it's starting with Marjorie Taylor Greene. Let me give you an idea who Marjorie Taylor Greene is. She was one of Trump's loyal supporters. And after his election and things with, particularly with the Epstein file, I mean, she's really come against him. And I think she's standing up for America, right? So she began to say things that Republicans typically don't say, right? Like give people health care. Let's look at here. Let's see what she has here, okay?
One of the most controversial members of Congress, Republican Representative Marjorie Taylor Greene of Georgia, usually draws the ire of Democrats, but now she's speaking out against some in her own party and coming out in favor of what Democrats demand to reopen the government, an extension of enhanced health care subsidies.
Congresswoman Greene, thank you for joining us here in the Situation Room. We appreciate it.
Thank you for having me.
Let's start there. Let's start with the shutdown. So you voted for the short-term funding bill, but now you're talking about this healthcare issue. Help us better understand why now?
Well, actually, this is something I talked about when I first ran for Congress in 2020, because I grew up in a construction company family. Bought that company after college and retired my parents. And after the ACA was passed,
The Affordable Care Act.
Yes, the Affordable Care Act, our family's health insurance premium went from $800 a month to $2,400 a month. So I've known about this as a major problem for a long time. It's not just ACA recipients whose premiums are going to skyrocket very soon. It has been a disaster for many Americans across the board. And
so let me just tell you this. Okay, your insurance policies premiums may double. This is what she's talking about. And in this phase, who could afford that? I mean, we're giving billions away to Israel, but then we're going to have to pay for it for more of ourselves in high. We're not going to have the range of Medicaid services, and then everything's going to cost us more.
Cost of living is so high now. Many of my constituents, many of my friends, and even my own children are finding health insurance to be extremely unaffordable and something that they are having to go without. So I think this is an incredibly important issue. I think it is a crisis. I don't think it's something to wear political party team jerseys on. I think it's something that we have to address and fix.
And it's very personal for you.
Very personal. It's affected my own life. And the Affordable Care Act was passed in 2010. So we're 15 years down the road, and the industry has changed drastically. Many companies dropped out of the market. We've seen doctors stop having their own practices and become hospital employees. We now have to import doctors because we don't have enough. Healthcare has drastically changed. And I'm one of those that gets real tired of political drama when it's not actually solving a problem. And this is.
Yeah, so she's splitting with the Democrats, with the Republicans on this, remember? And so they called the Affordable Health Care Act Obamacare, and they talked down about it. Now she's saying with the changes, cuts in Medicare. Let me just go through here real quick. Let me just ask. Okay, let me just ask this. Let me just go through the proposed changes Okay, here are the top 10 results. Okay, change is coming to the ACA bill. See here. Okay, the law will result in up to 15 million more people without health insurance in 2034. Includes over 1 trillion in spending cuts to healthcare through 2034. $1 trillion in healthcare. It's the biggest cut to our society's safety net in history. Yeah, we're talking about the $1 trillion. The requirement applies all able-bodied Medicare recipients between the age of 19 and 64, but there are numerous reasons why someone be exempt to work. There's a work requirement. Why are these new work requirements expected to result in so many people losing access to Medicaid coverage? There are a few reasons these requirements will result in people losing coverage. First, most Americans in Medicaid are located in geographic areas where there is no school, no jobs, and there's no nothing but volunteers, especially for 80 hours or more for a month. Yeah, no jobs. How does someone determine whether they qualify for an exception or not? Okay, let me get back here. Okay, so we're talking about $1 trillion lost in healthcare, particularly in Medicaid. And so we're talking about the hospitals on the south side of Chicago already being stressed, and further further cuts in the budgets, even more. Let's see here. Okay, let me see here. 6 hours ago, Bad Bunny. What's the Bad Bunny? What's this Bad Bunny situation? I'm getting confused. I heard that several times. Let me see, Bad Bunny. Okay, this is the guy who's the pro-Palestinian. Okay, Bad Bunny. Okay, Bad Bunny. I gotta look at his stuff. Let me see. Any releases? Let me. Wow. Okay, Bad Bunny's been around.
Hell is different.
No, let me get back on track. Okay, the Bad Bunny and Marjorie Taylor Greene, Alexandra Cortez. Let me see here.
All right, so I know there's a lot of serious stuff going on in the news right now. Part of me almost wants to do like 2 serious updates and then 1 less serious update just to keep us going, you know? Anyways, I want to call your attention to this. The whole Bad Bunny situation, Marjorie Taylor Greene, like super upset because he said, you know, y'all have 4 months to learn Spanish. And I want to let you know, I've worked on a committee with this woman. I've seen her try to read. They're not mad because he's speaking Spanish. They're mad, and she's mad because she can barely speak English. And the idea of introducing any more words is
I didn't know
to
politics got this much where it's personal like
that. She may
that.
have just learned acetaminophen this week.
I didn't know it got this bad. I didn't know it got that bad.
In order to find records related to President Trump.
Trump is being Trump. There's no other way to say it.
Let me see. Okay, he goes nuclear on Trump. Let me see. Okay, Marjorie Taylor Greene herself doesn't buy it. Hakeem Jeffrey slams GOP ACA subsidies.
That November 1st deadline, especially when, to put this in context, we have not seen really any movement from Republicans suggesting we're going to do anything until you agree to open the government. So at what point do you have to acquiesce in order to, protect the people and actually try to get something done?
We have seen rhetorical movement from Republicans, but actions speak louder than words. Sort of in mid to late September, what we heard from Republicans was that they passed the clean continuing resolution. Of course they didn't. It was a dirty partisan bill that continues to gut the healthcare of the American people. Then they tried to lie about the nature of the fight and pretend as if Democrats were fighting for anyone other than everyday Americans, working class Americans, and middle class Americans.
Let me go back. Let me see what they're saying here. Goes nuclear here. What's
Marjorie Taylor Greene breaks with her party and starts to sound sane? I can't believe it either. This is just another day.
Well, I've been saying reopen the government. Republicans in the House and Senate need to do their job and come up with a solution for the American people.
Am I in the upside down right now? Wait, the upside down is the toxic hellscape where every day is worse than the last. So does that mean that I've been there for months and then this is a break from that? Maybe I should table.
Yeah, I agree. I didn't expect this. But, you know, the healthcare thing on the Singularity here, you know, healthcare is over. You know, I'm not sure where we're going to go, but my my theory is that you know, the Singularity is here, and it's going to be irreversible changes into two groups: the haves versus the have-nots. And if you are have-nots, if you don't have anything after this AI revolution, then you put yourself in the position to be useless. Meaning the people who have really don't have a use for you. So if they don't have a use for you, then why would they pay for health care for you? You got me? So I think the Singularity here, and Marjorie Taylor Greene, a staunch mega supporter, is now fighting for health care for people who will be rendered useless. I think that's where she goes. She doesn't want to cross that ideological line, right? She's not going to sell her mother, her grandparents, her family, her neighbors out for whatever MAGA wants. It seems like she's drawing her limits. And I say, hey, that's an indication that, hey, we're almost near the end. There's no, if they view you as useless, then there's no way they're going to give you health care. Take that with a grain of salt, okay? But I think you should start thinking about what I'm saying. I think you start really thinking about preparing you and your family for the changes that are going to be coming about. I think these changes are going to be sudden. They're going to be rather severe. And you have to start diversifying your income, getting rid of, paying down your debt. Most importantly, get away from these narcissists, psychopaths, and sociopaths. We are at the beginning of World War III, and I don't think things are going to get well. We are $27 trillion in debt in the middle of wars that we can't afford. And now they're eliminating health care. Things are about to change very quick. We are entering the information age, and I suggest that you take that seriously. I hope you enjoyed my discussion. The Singularity is here. Hey, the end is here, y'all. Take care. Read out. Ciao, guys.